Regarding prevention, as I've mentioned, there are several initiatives. Some are done at the European level, and some are done locally in each country, and that's important to have a good link, a good connection. The European Society of Cardiology has a prevention association which is devoted for the prevention issues. There have been organized different initiatives. There were released this year the new guidelines on prevention with update on different goals that we try to reach in terms of weight, in terms of smoking cessation, in terms of cholesterol levels and so on. In terms of lifestyle changes, modification to have healthy lifestyles, and those are very important that they, on one hand, are global, but on the other hand, they need to be applied locally. And that's where the national societies or foundations have a very important role. Because these foundations and these societies, they know the specificity for each country. And so they know exactly how to better interface with the population. It's always difficult to change lifestyle, for instance. People have to be motivated. They have to have the data. They have to understand how important it is to stop smoking. And we have, for instance, and we have now scientific data showing that just by having the law of not smoking in closed spaces, there was a reduction of 25% of acute myocardial infarction in non-smokers. And this is very important because this is the evidence that having these laws, and we know that we as doctors, we have to provide the information, then the politicians make the laws, but they have to be informed about these things. And here we're talking about primary prevention, so meaning people that never had the disease, trying to reduce the number of people that will have the disease. So there are a lot of potential implications of scientific results that will translate into political decisions for each country. And it's very important that in Europe we have some harmonization and we have some common knowledge so we can apply the best for each one of our countries. Well, we have two different levels. One is a level to the population in general, and there the scientific societies have a role together with the governments and with the organizations that are involved in health-related issues. So it's sort of a campaign to provide to the public, to the general public, this type of information. This is a teamwork, and this teamwork should be important to convey the message to the individual patient or to the individual what sort of influence some small changes, some are not so small, but some changes in lifestyle can impact on his or her life, not only in terms of the prolongation of life, but also the quality of life. And I think that's very crucial. So two big things. One, general information. The other one, individual information through a team approach by health professionals to provide as much information and as adequate information as possible to the individual. Well, I think we need to work together, and it's very important that we, in Europe, we are different countries, we have different well, I think we have a lot in common, actually. But there are some things that are a little bit different, but one thing is for sure. Myocardial infarction in Romania is the same as in Portugal, or is in Paris, or is in London. We are human beings, and we have exactly the same type of problems. We just have some local differences, but these differences sometimes are easier to reduce if we understand that our common goal is to reduce the burden of cardiovascular disease, and for that we need to work together. And the fact that the Romanian Society of Cardiology is part of the European Society of Cardiology, as 54 other national societies, it's very important because that's the way we have to have a common word, to have common messages that can convey throughout Europe, so the governments, the politicians, the people know what is the best to improve cardiovascular or to decrease the burden of cardiovascular disease in Europe.